In this video, we will be demonstrating the best retinectomy, that is, bloodless, easy and safe technique of retinectomy. Proliferative vitreoretinopathy is the most common cause of recurrent retinal detachment. A basic approach to recurrent retinal detachment is to peel the proliferative vitreoretinopathy membranes. After peeling the membranes, if the retina is stiff and immobile, it denotes residual contraction of the retina. In such a scenario, as seen by the immobile retina around the break in the video, one needs to resort to retinectomy to settle the retina. Site of retinectomy is planned such that it extends beyond the area of contracted retina into the adjoining normal retina. Diathermy is done at the intended site to prevent bleeding. Retinectomy was commonly done with a scissor in the past. Nowadays, retinectomy is often performed with a vitrector. In spite of doing diathermy beforehand, bleeding often occurs during retinectomy. Bleeding leads to intraoperative problems such as loss of media clarity, subretinal seepage of blood, and thereby interfering with retinal opposition with retinal pigment epithelium and effective laser photocoagulation. Postoperatively, the chances of lifting of the retinectomy edge increases, leading to recurrent retinal detachment. We present a bloodless, easy and safe technique of retinectomy using a flute needle or an extrusion needle. In this technique, diathermy is done using excessive energy. This itself induces retinotomy at multiple places on the retina. Thereafter, passive suction of extrusion needle is applied over the diathermized necrotic retina along with slight traction so as to induce discontinuity of the retina. Vitrector is used to remove the anterior retinal flap and also to cut the diathermized blood vessels which are not broken by passive suction of extrusion needle and are bridging the anterior retinal flap and the posterior retina. Careful dissection of the retina done in this manner prevents excessive bleeding at the retinectomy site. 3 to 5 rows of laser is done to the edge of retinectomy. Direct perfluorocarbon liquid and silicone oil exchange completes the main surgical procedure. In summary, retinectomy done by passive suction of extrusion needle ensures a best retinectomy, that is, bloodless, easy and safe technique of retinectomy.